Patients with pulmonary arterial hypertension have significant morbidity and mortality. We know that best medical therapy provides benefits, but patients continue to have symptoms. Patients in that population have indicators that their sympathetic activity has increased. So Trophy 1 enrolled patients, 23 of them, with pulmonary arterial hypertension in WHO class 3, significant symptoms, who were on best medical therapy to investigate feasibility and safety and early efficacy of ultrasound pulmonary artery denervation in that population. Because patients have increased activity in their sympathetic system, we tried to target that by reducing the nerve supply to the pulmonary vasculature. The way in which we investigated that in the study was initially to look at the safety of the procedure, which was very good, but beyond that to see the effect on the blood pressure and the resistance to flow within the lungs, or the blood vessels that supply the lungs. In the study, those numbers were improved, so the pressures in the lungs were reduced, and then we looked to see how that affected their daily activity. So in a measured walk test, patients walked further following the procedure, and then using a wrist-based step counter or activity monitor during their daily activity, measured over a 14-day period, patients did more activity during that time period. So as well as reducing the blood pressure, which is something they can't necessarily feel or tell themselves, we're able to show that there was an improvement in what they were actually able to do through the study. It's an early phase study, so I think the primary thing to stress is that the procedure was feasible, and at least in the patients that we examined it was safe. From that, we reduced pulmonary vascular resistance by 1.2 Wood units. We increased the distance that patients could walk following the procedure by 42 metres, and increased their daily activity by about 10%, which was 172 steps per day. I think the procedure is very feasible, very safe. It was well tolerated by the patients during the procedure, and there are early signs of efficacy in this population. And certainly in the patients that we've treated so far, the risk profile has been good. We've had no major procedure-related adverse events. We'll find out as we do more.